I'm advocating for healthcare reform, and I'm representing youth and young adults in the greater New Orleans area who need health insurance but can't afford it.
I'm from a community that includes people who are working class, who are undocumented, who are living below the poverty line. So any of the needs for justice that affect those people are my people.
I feel it was very important for me to be here, especially for those women who aren't able to be here today and voice their experiences and share their stories of how the lack of health care and reproductive health care services has a major impact not only on their lives but the lives of their families.
Reproductive justice demands that we consider health care, the needs of women, the health care needs of women as the center of what healthcare is.
We can't go around moral issues. Healthcare is not a moral discussion. Everybody has the right to make their own decisions.
Separate the emotions from the abortion issue and get back to what it is, the healthcare issue. How we have all these millions of Americans who are without health care.
I am a part of the working class, but I make a little bit too much money to apply for or qualify for Medicaid, which means that I have to go to private insurance, which I can't afford. And there's so many other young adults who can't afford private insurance as well.
Right now, the hospital, the only free adolescent behavioral health service in New Orleans, the hospital is closing.
As a woman who pays for health insurance, I too am limited. And if I'm limited in my ability to access services that I need, then I know that there are other women who have little or no access who are not getting the health care that they need.
We have a system now that is broken, and if this is the last and probably best chance to revise and fix that system, so I would ask and implore our senators, our congressmen, to do the right thing. Fruitful meeting, fruitful.
We were able to have a really good dialogue, and we were able to express our concerns with the current state of healthcare and also hear the senator's position.
We went around and around on language, and I think that's a big barrier between the constituency and our officials, that we're talking two different languages. I think it's really important for us to really look at the foundation of what we're really talking about and stop kind of going around and around the bush on all of these different things and really come to a common language.
It's good that we were here, that we were able to get our voices out, to use all channels of democracy, but I have a feeling that's going to take a lot more than this.
I really don't believe in electoral politics, but I do believe in an active citizenry. I do believe in increasing democratic participation. And so I feel like being here and saying what I have to say, I think she's going to vote the way she's going to vote. But I feel like, God damn it, she's going to vote with my 2 cents.
We had the opportunity to have our voices heard, and I think that's what this whole process is all about, is communicating our vision for our community.
And so, I can't predict how the senator will vote in the future, but I can say that she heard our position.
We need to make sure that we find a health plan that makes sure that people like me can afford it, and people have the right to make the choices that they want to make.
Healthcare is not just about whether or not you get insurance. Like, it's about whether or not we have care.
We have to step back and look at the basic human right to live and be healthy.